So I'm Esther Obonyo. I'm going to do a presentation on the basic indicators in quality management of severe malaria. This was a retrospective study conducted in Rongo Sub-County Hospital. Basically, it was due to the prevalence of malaria in Rongo or in Migori, which is 21%. So in as much as the interventions are there, we still have a high prevalence. And just that background. So you find that the malaria morbidity still accounts for 30% of outpatient management and 15% of inpatient. And actually, we even have 1% of deaths. But 1% when translated into persons, it's a lot. So the healthcare providers' capacity for early detection and management of complications is key in improving the outcome of these patients admitted with severe malaria. So this sub-county hospital, we have 76 healthcare workers, of which 20% of the 76 are trained on malaria case management, and we have 4 mentors with 2 healthcare providers trained on management of severe malaria. So data was collected from inpatient files, from the records after being done for coding. Then we sampled 59 files, of which we checked on this, and this was to look at the trend of malaria from 2019, and you know that 2019, December, we had COVID-19, so the better part of 2020, there were very few admissions, as you can see from the trend graph, and 2020, patients started coming back to the facility, and 2022. So again, 2022 was a stable year. So our client files, the 59, were selected from admissions of 2022. That is just the prevalence of malaria in Migori County, as you can see from the map. So percentage of inpatients who are admitted, 40% of these patients took 2 days in the ward. And you know, with severe malaria, we give the recommended treatment is, which one? Recommended treatment for severe malaria. First line. Thank you so much. Artesunate injection, of which I know all of us here know how to reconstitute artesunate. So 40.7% of these patients took 2 days, and artesunate we give for 24 hours at 0 hours, 12 hours, then at 24 hours. And these patients are able to improve and be discharged home. 37.3 took 2 days in the ward, 13 took 4 days, 6.8 took 5 days, and 1.7 took 6 days. We were interested in this who took 6 days in the ward, but we found out that they had co-infection. That's why they took the many days in the ward. So now the proportion of those who had done the basic minimal indicators for a patient, one was observation. And we all know what we observe in a patient. We need to have that observation chart where we check the temperature, pulse, respiration, blood pressure. So 81%, actually majority had the observations done, and only 18 did not have observations. So why? Then on IV fluids, those who are on IV fluids, 50 50% of them had IV fluids. And then out of the 50% that had IV fluids, you can see that 32% had fluid chart. So what happened to the other 78% of these patients? Why were they not having fluid input-output chart? And you know what it means. If you are giving IV fluids and you are not monitoring the output, either the patient may go into renal failure unknowingly, or the patient is having fluid overload and you are not keen on it. And we know the complications. Then nursing care, I'm happy with what we are doing as nurses, that 83, actually majority had nursing care plan. Then the cardiacs, this is where there was a big challenge, that 18% had the cardiacs. So what about these other 81% that did not have nursing cardiacs? Then on artesunate administration, again, we'll have questions. So artesunate, 100% of these patients were given artesunate as required at 0 hours, 12 hours, and 24 hours. Then AL as a maintenance dose was also given. So in conclusion, there was 100% compliance in artesunate administration, and then there is incomplete monitoring of admitted patients, as we have seen from the graph, because we were looking at the files, purely at the files. Then there is a gap in post-discharge follow-up, as we have seen that not all the patients were on artesunate maintenance dose after the administration, on AL maintenance dose as after administration of artesunate. So the recommendations was that the facility to sustain the best practices that was being done, as we had seen. Then strengthening of inpatient nursing care processes should be done, especially complete monitoring of admitted patients with severe malaria, of which that should extend to other patients also who are admitted in the ward. And then strengthening the post-discharge follow-up through sensitization of the patients, emphasizing on their follow-up. Then public health action is to develop community intervention also to support post-discharge follow-up at the household level, and also to encourage patients to adhere to the discharge treatment. Thank you.
Yeah, my comment or question goes to Esther. And I want to thank her for honesty and for that bold decision just to do an audit or to observe what is happening. And as much as maybe there were mamas, better you who know where you are than us who mamaed who may be worse. Because when something is done in 1%, that is one institution. You imagine it is others like that 10 or more in the country. So when you see CADEX was not being done, and CADEX is the nurse's document actually, what could have been the reason? And what measures maybe has the institution done to improve on that? Because there must be a reason. Thank you.
Okay, thank you so much for that question. Actually, after doing this study, we shared it out with the hospital management team first, that's the departmental heads, because some were also not cutting, not only on nursing, but even random blood sugar was not checked. So we shared this with the lab, the pharmacist, and the other clinicians. So after this, the nurses was talking about the documents, the papers to write the codex. So on that week, the hospital administration took it up. You know, it was also shocking to the others, just the way we were all shocked here. So they took it up, and they even came to the team that was doing a study and reported that, Esther, now go back to the ward, and you will see what we have done. So that week, even you could not take a patient to the ward with some notes missing. All the observations, you hand over the patient in the ward with all the documents available. So it was a plus. Yeah.